Good afternoon and welcome to the second of our Trekstock Talks on fertility. We are now joined by Monica Figueiredo. I've just been practicing her name, and I got it right?
Yes, you got it
right. Great. So Monica is a clinical nurse specialist at Imperial College.
Yes.
That's correct. But is also a nurse doing it's a nurse research. Is that right?
Yes.
Nurse research in male fertility. So this part of the interview series is going to be looking at male fertility in particular, and we're going to be looking into the effect on male fertility through cancer treatments. So we should probably start there then about what what effect does cancer treatments can they have on male fertility?
So basically, as we all know, chemotherapy, for instance, affects the cells that are dividing quite quickly in our body. And so the cells that are responsible for producing sperm are called germ cells, which are inside of the testicles. So basically those cells are affected by radiotherapy, chemotherapy, etc., etc. So we are expecting that if the patients are going to be submitted to chemotherapy, radiotherapy, surgery, stem cell transplants, will have their fertility affected, yes. In how many ways? Well, it depends on the strength of the treatment, on the type of, or how many sessions of treatment they have, which type of chemotherapy it is, and also if they have been had stem cell transplant or a full body radiotherapy. So it depends, again, it's case by case. We never know for sure the full impact. So it depends on, again, patient by patient, treatment by treatment.
Which is why there are lots of options available around it to make sure that there is things in place if fertility does go.
That's why it's really important for the patients, before they go to any of the treatments, to have an open conversation with the clinician, oncologist or the specialist they have been followed by, in order to understand fully what are going to be the consequences of each treatment.
Yes.
Even the surgery sometimes can be painful.
Yes.
For patients also, and also interfere with their sexual relationships, for instance. Yeah. So it's really important that the patients fully understand what's going to happen after the treatment, and also to discuss. Really important to discuss the cryopreservation. So to discuss the possibility for men, for instance, to freeze some sperm before they go to these treatments.
Yes.
Because we never know if they're going to recover their fertility after the chemotherapy, radiotherapy, surgery, etc.
Because one of the things I was talking about earlier was that one of the difficult things, obviously, as a young male going into that experience of being told that you might not be fertile, is that you don't really know much about that world of thinking about children or anything like that when you're younger anyway, because you were kind of going, I'd never thought about having children. That was the thing. I just kind of was 19 and then 21, and I was kind of like, okay, that's fine. I wasn't thinking about children anyway because I was still a child. So, and that must be something that happens quite a lot, that you're making these decisions when you're in this kind of weird hurricane as such.
Yes, that's one of the things that may happen. Yes, you're right. But it's, even if you are not foreseeing that in the future, it's really important that the clinicians actually discuss this.
Yes.
Because even if this is not something that you're thinking now, in the future, you are going to think about it. So it's really important that the patient actually ask the questions for itself.
Yes.
So to be interested in their own treatment, to ask questions, to pursue answers, and to insist on having all of the information available in all the treatment options possible. This is really important.
And because patients can be like wide range, but when we're talking about like younger years and young adults going through these treatments, young men, is there an age like that you can have is there a minimum maximum age?
There's no minimum age actually to store sperm.
Yeah.
Obviously, as all of us know, in order to give a sperm sample, you need to actually produce the sample.
Yes, yes.
So you need to actually be going through, basically, you have to be in a puberty. So you have to have enough testosterone in order to produce a sample.
Yes, yeah.
And that's the minimum. And obviously, the patients, when they come to our department, if they are of a younger age, we still need to assess their competency in order to, if they understand the procedure, if they understand what they're going to do, and obviously, so that's a Fraser or a Gillick competence, which needs to be assessed. And then the parents may be also with the child, also in order to give extra support.
Yes, yeah.
And then we could offer then the treatment, or we could offer the sperm cryopreservation for the children. But no, there's no age limit.
No. But when we're talking about these options, can we give a broad overview of what are the options for young people when they are facing infertility? Is there what is available to young men?
So what is available? So basically, sperm banking is a well-known way of actually preserving the fertility. Yeah. There are other techniques, but they are not that developed yet in order for us to be 100% sure how effective they are going to be.
Yes.
Yeah? So yes, sperm banking, it is the ultimate choice.
Yeah. And what is sperm banking?
So basically, what is sperm banking? So basically is that actually we could discuss that later on the so basically sperm banking is when you go to one of the fertility centers, produce a fresh sample, and then you are offered the chance of freezing the sperm. So basically, in order for you to freeze the sperm effectively, you need to add a protective, so a liquid which is called cryoprotectant, which will protect the sperm before it's frozen.
Okay.
And normally it will be frozen in minus 196 degrees in a big tank in liquid nitrogen, but now it's vapor, in the vapor status. So then they will keep with then the sperm will be kept like that until it's needed. Okay.
And how long are we talking? How long can it be kept in that vapor now?
It depends. So we don't have a actual time or a validity or expiry date.
Oh really? Okay.
As you can say, yes, we don't have that. So the samples can be stored, obviously, without affecting the quality anyway. But like I said, but there's more to that in terms of legislation of how long could you keep it.
Yes.
That's for another. Yeah, so that's another conversation.
And so if we're looking at what with sperm banking, it is available. I'm right in thinking it is available in the NHS for a certain amount of time.
So yes, so normally, so if you are if you have a diagnosis of cancer,
yes,
you will have funded by the NHS sperm from 5 to 10 years.
Yes.
Okay. Further storage or of that sperm obviously will depend on if you need it or not.
Yeah.
For instance, some patients may recover from their fertility. Therefore, there's no need to keep the samples frozen anyway because they are already fertile and they can actually conceive at any time they want.
Yes.
Plus, any clinic in the world will prefer a fresh sperm rather than a frozen one. So if you have regained your fertility, there's no point in keeping the samples frozen anyway. So that at that time you may want to dispose. Yeah, but if you need further storage, obviously that will be available. Okay.
And how much does it cost the NHS to keep it frozen?
The NHS.
Yeah.
Or you.
Well, how much would it cost you if you were so for me, if I was coming to the end of my 10 years and I was like, well, actually I want to keep them frozen for a little while longer, how much would it cost me?
Well, for instance, in general, they are different. So the freezing costs, they are increased. So the more work is on the beginning. So when we are freezing the samples from the start, that will take more time and it's more costly.
Right, yeah.
While the samples are on the bank, there's just a maintenance cost, so just a maintenance of the cost of the nitrogen to fill in the tanks. Okay, but in general, 250 to 300 pounds a year.
Yes.
That's the cost that is involved.
So 250 to 300 pounds a year,
yes.
to give you that option.
So if you are a patient that are in the private sector, that have been followed by private, okay, and you still want to come to our department to free some sperm on the private way, you can always do it, but with those costs involved.
Yeah. And then, so we've been looking at how treatments can have an effect on your fertility and can really, and there's a good chance that with certain treatments that you will be infertile, but it can change as well, can't it? Because can your fertility come back? Like
Yes.
does it grow back? Because I've had over time I've had a very strange thing, Monica, where I was told that I was infertile. I had a stem cell transplant, and I was told that I would most probably, and they did say most probably be infertile, and I was like, oh, okay, that's understandable. I will accept that. I'm having a big stem cell transplant, but then most recently was told that I probably am fertile, which is incredible. It's a strange thought after kind of going, oh, I'm definitely not fertile, but now thinking I am. But so how does that happen? How am I still fertile? That's my question.
So exactly. So that is quite common in our patients nowadays. So basically what happens is when you're diagnosed with cancer, there's more things going through your mind at the moment than just fertility.
Yeah.
So normally after the diagnosis you think of cure, you think of treatments, you think of getting through that phase and survive.
Yes.
Those are your main priorities when you're diagnosed with cancer.
Yeah.
And people will, obviously consultants and will talk about fertility, but the amounts of the capacity for you to basically understand all of the information that is being given you at the time is limited. So you can't receive all of the information and process it.
Totally,
you know what I mean? So then obviously sometimes there's miscommunication, or people may assume that they are infertile anyway, regardless. And that's what happens to the patients that majority of the patients that come to our clinic. So that's why it's really important to have your fertility status checked. And we are quite lucky actually, because the charity, Imperial Charity, funded a project, a pioneer project in our department, in the urology department, which permits nurse-led clinic to be established, which I was part of it, me and the consultant, Dr. Chana Jayasina. And we could, with this funding, we could offer a completely different service to patients that had frozen sperm with us. So we could offer them consultations in order for them to be able to check their fertility status, 2 years post-freezing, 5 years post-freezing, and 3 years post-freezing. So this will enable the patients again to know their fertility status and to make better decisions in the future. So in your case, if you didn't know you were fertile, you may, who knows, God knows, you could
have 5 kids by now,
exactly. So,
exactly.
It's about receiving the information you need and decide.
How often do you say then is there time to go and be retested? So you finish your treatment, and you is there a period of time that you should then think about being retested?
Well, at the moment, there's no guidelines saying that the patients are obliged to test. So, but that's why we're emphasizing the importance of the patients to seek to have the fertility checked, because if you don't know the fertility status, you may possibly be delaying relationships, delaying conversations regarding having children, be having a certain amount of stress and other psychosexual problems involved that you're not really aware of, but they are sort of in the back of your mind, kind of hidden, and that will basically affect your life in so many ways and you're not even aware of. Yes.
Yes.
And only when you start talking about it. And even if someone sends you a letter, for instance, saying, do you want to have your fertility retested? Then all of that submerges, and then all of that comes to your knowledge, and then you think about, oh my God, and then you get stressed all of a sudden. I'm going to, I don't want to know. Some patients don't want to know. Some patients are afraid. Some patients are, please, yes, let me know. Yes.
Yeah.
But it's really important to actually have it tested and make the best decisions for your life. I don't know if I answered your question.
You answered it perfectly. Okay. So Monica, if I'm thinking about being retested, okay, there's if there are any young men who are watching now who are going, I want to go and be retested.
Yeah.
What happens? You will go to maybe Imperial or wherever it is that you're, because Trekstock's across obviously a whole of the country, and is it what I'm interested in is that what actually happens in the like when you're looking at the sperm? What is that?
Well, at the moment, so either you could go through your GP.
GP, okay.
If you're not one of our patients, that option may not be available in all of the fertility centers.
I went through my GP. That's how I did it. Yeah. So
you can go through your GP and ask for a semen analysis, and then we are more than happy to offer our services to anyone else that wants to visit us, and then you will have your answer. Yeah. Or after you produce the semen sample, then that sample is going to be analyzed in our laboratory, and then the results are going to be sent to the GP or to the consultant that requested the samples.
Yes.
The exam. If you are one of our patients, we are in a position of offering that. Even if you don't need to go to your GP, we are in a position to offer that to our patients.
And the actual testing itself, I think we've got a drill going on next door.
The testing itself, is all of the fertility clinics should have a production room. So patients will come in, they are going to be given a pot.
Yes.
They will have a production room where they can go. It's completely individual.
Yeah.
And then after they produce the sample, they will give it to our receptionist, which will confirm your name, date of birth, your NHS number, possibly.
Yes, those. Yeah.
Because that's one of the requirements, and then they will give it to the lab in order for the lab to analyze, and that's it.
And
production-wise, yes.
And if you're getting the results, and the results are saying things like low sperm count, what I never understand that phrase. What does it just mean? You've got less of them, or that they're not swimming so well? Swimming.
Well,
I don't you see, that's the knowledge bank.
According to the World Health Organization, there are some parameters that we look for, and obviously some range numbers that we're looking for.
Yeah.
So it's not just the number of sperm that is in the it's also how quick they move, and the quality of the sperm, the morphology,
yes,
how well they look under the microscope,
right,
and other factors also. So it's not just the count; it's also the quality of that sperm.
So it's about so we've got the quality of the sperm, and it's looking at how they look underneath the microscope.
Yes, and how well they look. Yes, it's not just how much they are. That's why it's important for the sperm analysis to be discussed either by a GP or by a clinician that actually understands. So in this case, a neurologist or sometimes an endocrinologist. So if your GP can't help, you can always ask to be referred for a specialist.
Yes.
In fertility, those people are the ones that could actually look at your case and decide the specific treatment. Yes.
And so we're talking about that you're going to go and talk to, go and actually talk to your GP, or to go down those routes. There's obviously somebody else, sometimes involved in those discussions, a partner. What advice do you give to somebody who's going through this and the discussions they might have with their partner?
So, it's really important that if you have a fertility issue and if you have a partner, is obviously is an individual experience, isn't it? So you are the best person to know when you feel more comfortable to discuss. In our clinics, what we see is patients delaying the involvement of the partner in the fertility issue.
Right.
Well, the longer it takes you to actually disclose that information to your partner,
Yes.
the more you delay the possibility of that person that is involved in your life, and it will be involved in starting a family and whatever, it's a part of your support. The longer it takes for them to actually have the opportunity to also ask questions, to be involved, to support you, you will be, kind of surprised of how they will actually support and accept that part of you, isn't it?
Yeah. So involving that person when you feel comfortable to do so, I guess,
but as quick as possible. You can always bring a partner. If you can't tell, one of our patients actually once said something really amazing, that he would love to actually have the chance of bringing that person to a consultation when they were disclosing their fertility status. It is so much easier to bring the partner, and then rather than him saying, you know what, I think I'm infertile.
Yes.
So by all means, bring the partner, involve them, and then they also can be a part of it and support you.
I guess as well, though, it depends on how long you've been with that person, or how comfortable you are to be, like, you might not be that far into a relationship, and then suddenly you're facing up to this big decision and you're having to bring them along. It's quite a tough thing.
Especially if you are starting a new relationship.
Yes.
Because if you have a long-term relationship, and if that person was in your life before the diagnosis, it's easier to disclose the rest of the information, because that person knows already that you had a diagnosis, you've been through treatment. Chances are there's going to be some issues in the fertility in the future. So yes, you're right. If you don't have a relationship formed at the time of the diagnostics, can be a bit more difficult, but still you can bring the partner with you.
So if you are starting a relationship, it's working out when's the best time, but bringing it up as quickly as possible for if you're in a relationship already and feeling comfortable with that.
Yes.
And then if it's a new relationship, you're starting a new relationship, is there advice on when it's good to bring up fertility, or is that?
Well, it's a part of you, isn't it?
Yes.
Your situation is a part of you.
Yeah.
You can't just change it. And the person that wants to build a relationship with you based on trust, confidence, love, etc., when a plan for the future, will be the best person, actually will be the most interested person in that, in knowing you and knowing your plans too for the future. So obviously she should be the one knowing at front what may happen in the future. That doesn't mean you can't have a relationship, or you won't love that person the same way, but this is a part of me, this is something that may happen in the future, so are you with me or not? So it's a bit more like this.
We mentioned we mentioned earlier the kind of psychological side of infertility, and what's like it's a major thing, right? It's like it especially like in my experience of being a young adult and going, not really contemplating it really when it was happening, and then a couple of years down the line when I'm now starting to think that children might be something I'm thinking about, it's now suddenly a question, and the question is only there because of cryogenic freezing and all that stuff, and that's incredible and things, but what is available to people who are facing up to those psychological things that happen with fertility? Well,
it's not that well studied, the impacts of and psychosexual impacts of cancer in fertility, actually. That's why I'm doing a research at the moment regarding psychosexual impact of cancer in fertility. And at the moment, we are doing this research, me and Dr. Chandra, and basically we are at a point of we are sending some questionnaires online and via post to try to gather some information about this, and also we are planning in the future of doing individual interviews with some of the patients to try to have a better in-depth understanding of exactly what are they feeling at the moment and how impacted they are after the cancer and the cancer treatment. So this is something that we are proud of being doing, and obviously for sure we will be publishing that, and we will be definitely bringing it on to our practice. So yeah, that's one of the things we are now. But yes, there is some impact. Yes, delay in the relationships, stress, problems sometimes with erection, etc., etc., etc. So there's loads of things involved, which I'm not going to disclose all of them, but yes, there's a lot of issues coming from.
And this isn't something that is regularly talking about. If we're being very stereotypical, men are less keen probably to talk about these things, or am I being stereotypical? Like, I'd say that like it's like talking about fertility, and especially male fertility, is something that's a little bit more hush. Like men are, well, I know from my experience, like I kind of run away from it a bit and go, oh, it's not something I really want to discuss that much. But is that something you're seeing through your research?
Depends. So not only with my research, but also, like I said, on that nurse-led clinic where I could see the patients and check their fertility status. So some of them will be quite keen in coming in. Some of them really want to know because either they are in a relationship or the partner had the conversation, where do we start our family, or some of them are quite keen on coming in.
Yes.
Others are a bit reluctant, they're a bit afraid and a bit stressed.
Yes.
So yeah, you have both types of patients. I think it's individual.
Brilliant. Well, thank you so much, Monica, for all these. So, like, if you are thinking about looking at whether you are still fertile and wanting to go and look into that a little bit more, like as we've heard from Monica, the best way to do is to either go through your GP, or if you are linked to Imperial, there's that route as well. It's really important to talk about these things, as we've been talking with Monica about them, and having the chance to do so. So if you are interested to go and do that, we also have Jemima, you can drop an email to, and again, she has made sure that I've got her card so I get the email address right. But it is health@trekstock.com, not anything else. Thank you so much for coming and talking with us today.
Tom.
Thank you.
Thank you.